Hello, my name is Victoria Gratham, and I'm going to be presenting to you my research about approaching female health, how connecting communities and empowering young girls can improve the HIV/AIDS epidemic in sub-Saharan Africa. As many in the already developed world are improving on HIV/AIDS rates, countries in sub-Saharan Africa are falling behind due to a multitude of reasons. Amongst the 19.6 million people living with HIV in sub-Saharan Africa, young women and girls make up around 12 million of them. This is due to mostly gendered issues like stigma, female inequality, mother-to-child transmission, child marriages, female genital mutilation, lack of formal education, and sexual assault. Inequalities in health, this is where we see causes of higher rates of contraction in social communities. Females in the sub-Saharan society are on a lower status than their male counterparts. Women see discrimination in access to healthcare or health services, education, and employment opportunities. Mother to child transmission. This is where we see a lot of people contracting HIV from. Mothers many times do not know their HIV status or understand how they can pass the virus to their children, and this is where we see health education failures. Child marriages, this is an issue not central to the sub-Saharan region, but it is seen all over the world, and in a case of HIV, child marriages provides complications. Girls married as children are more likely to be exposed to domestic violence by their husbands, and those who are married to someone 16 years older than them are 3 times more likely to have HIV than those less than 15 years older than them. And you can see the differences between this 1 year of age. HIV stigma, a lot of stigma surrounding the virus is due to sexuality and religious beliefs colliding, which is something we saw in the US early into the global pandemic. Many believe the virus can be passed off on surfaces, and many healthcare workers are discriminatory to those who are HIV positive, which causes an issue when people are trying to receive treatment for their HIV. FGM, this practice poses a multitude of medical issues that can be extremely harmful to the health of girls, but we do see cases of HIV being contracted from the traditional tools that are rarely cleaned or sanitized. In education, so many studies have shown the positive impacts of keeping girls in school past the secondary level, and we see lower rates of HIV contraction and the promotion of abstinence or even safer sex in general. Over the past few years, we have seen improvement in the rates of HIV infections, but there's still a great amount of their population to go, especially with young girls and women. Less than 60% of mothers in Western and Central Africa have access to HIV resources to prevent mothers to child transmission. In Mauritius, only 32% of young people are aware of how to prevent HIV. 50% of women who experience violence with their partners are more likely to have HIV compared to women who do not. And in 2018, 1.1 million children were living with HIV. Who or what is making an impact? What can we do to progress the life saving interventions further? There are a lot of aspects that kind of bleed into each other when evaluating the interventions, which is successful in its own. Education and empowerment. With Kakenya Ntaiya, she likes to see the success of young girls in rural Kenya succeed after community collaboration and education. Kakenya underwent FGM herself at a very young age and vowed to ensure other girls would not have to go through what she did. So she started a girls' school where she was able to bring their community into celebrating the success of the young girls. Eventually, the community ended FGM for girls and stopped early marriages. Kakenya was able to reach community leaders, traditional family members, and even included the elders who are extremely valued in the area. We see the investment in young girls through education, health, and leadership, all valued in preventing the spread of HIV or even extension of medications. This organization is the inspiration for this research and how impactful it is not only in the lives of girls and boys attending Kenya's schools, but the surrounding communities too. Promotion of testing and protecting pregnant women. In Nigeria, there is a program bringing HIV testing in churches specifically for pregnant mothers. Mother to child transmission is extremely common amongst other forms of transmission in the sub Saharan region, and with this intervention, over 115 community churches can reach pregnant mothers in need of certain resources. By design, they do not inform the mothers initially they're doing HIV testing due to the stigma that surrounds the issue, and not many will come voluntarily. So they provide other testing for malaria, high blood pressure, etc., all while still testing for the main reason of the whole thing, HIV. Programs designed for young girls, the UN's Initial Dreams program aimed to reduce HIV infections amongst adolescent girls and young women by 40% in 10 different countries and sub-Saharan region. Focuses were put on social isolation, economic disadvantage, discriminatory cultural norms, orphanhood, gender based violence, and education. Because this is a newer program, there's not much data success that has been reported, but there is some hope due to the reports of less HIV positive tests amongst those chosen in the communities of young women populations. The UN AIDS and UNICEF departments also implemented the All In program designed to involve adolescents in the response of HIV and allowing them to lead, design, and evaluate their programs. Just as the one before, there's not a lot of data over which has a more impact. Why do these interventions matter? What can we do to have realistic impacts? What's next? These few interventions have seen such positive responses and impacts that, if put into highly impacted areas of the region, we could possibly see the same positive reaction. Intersectoral collaboration in all aspects of resources from UN interventions, national legislation, and small organizational action can impose a change in the health of others all over. Kakenya's dream has nearly 100% of girls enrolled free of FGM, child marriage, and are able to finish school. Girls attending these schools are provided with counseling, food, medical treatment, and empowerment to succeed in their communities and even move to a university education. The baby shower program showed that 92% of mothers in their program decided to get tested compared to less than 50% being tested outside the program. One of the directors of the program reported that the baby showers are like perfume. Once the mothers smell it, they all come flocking around. Poverty and health issues in this region is extremely deep rooted and will require more than just a one stop intervention. Allowing women to be involved in the decisions about their own rights should be promoted and normalized within the sub Saharan region. For solving more than just the issue with HIV, we need intersectoral and intervention collaboration with the communities and understanding that young girls are valued in all aspects of the world. And to close this presentation, I'd like to present to you with a quote from Cleo Wade that answers why this is so important. There can be no liberation for one of us if the other is not free. Thank you.